Melissa Ettswold is the Associate Director of the Rural Experiences for Health Profession Students, also known as REHPS. Its main purpose is to give college students in a health major the experience of living and working in a rural town in South Dakota.
So they get the opportunity to have a 4-week, 3 or 4 week, they can choose actually, clinical experience where they get the opportunity to go in and shadow in their field of study. But then while they're also shadowing during their field of study, we're rotating them in to the other areas of healthcare.
Students enrolled at SDSU, USD, Mount Marty College, and Dakota Wesleyan University are eligible. When they apply to the summer internship, only 30 students are selected. Those selected are placed in small towns under 10,000 people where they help in the clinics and in the community.
So they're not just seeing the healthcare side of it, they're seeing what those people are doing inside their rural communities and how that all works together and to promote that patient care and more or less give them that holistic view of not just healthcare, but healthcare and living in a rural community.
Ettswold says some students that didn't picture themselves working in the rural area opened their minds because of this experience.
I kind of chuckle sometimes on some of them are like, I never would have thought about going rural. And after this experience, I have truly decided I think this is where I want to be.
Students living in rural areas get to experience the bond of a small community.
One of the other students this summer was unfortunately in a site that had suffered some tragic events and really learned how that doesn't affect just the team that helped them. It affects a lot of people throughout the process, if your first responders, your EMTs, all of that. And they thought it was pretty cool how the community all came together and rallied around all of them to support them.
Ettswold tells students working in a big city doesn't feel the same after working and experiencing the joys of a small community.
I had told a student earlier this year, we were having a conversation and I said, if you're not okay with your patients walking up to you in the grocery store and just saying, hi, how are you today? Rural is not for you. But if you really enjoy that aspect, then rural is for you because you are going to get that day in and day out.